Assalamu alaikum guys, welcome back to my YouTube channel. Glasses or PRK, Lasik, Lasek or Smile. These are the procedures that are commonly used these days for the treatment of refractive errors. So we will discuss in this video about all these procedures, what is the difference in the mechanism of action, the drawbacks and advantages of all of these, and which one of all the following you will recommend to your relatives or friends among all of them. I will leave that for you to decide in the end. So let's discuss. We will not discuss about glasses or spectacles in this one. We know about the basic reason behind it, that there are two types of lens: concave lens, convex lens, that are used, and the main function is to convert the light rays on the retina. So if you say, I can make another video on that, but we'll discuss about the procedures which I mentioned in this video. Now let's discuss why we need this procedure. Why is there blurring of vision or refractive error first? See, light rays are converged with the help of cornea and lens, and they're focused on the retina. Now if they're focused in front of the retina, that is known as myopia, nearsightedness people, and if they're focused behind the retina, those people are known as hyperopia, farsightedness. They can see the far objects but they cannot see the near objects. So for that, to correction of that, we need these procedures. Now either there is defect in the shape of the cornea, that the light rays are not being focused, or the eyeball, the size of the eyeball is too large that it cannot be focused on the retina. So these procedures cause reshaping. With the help of these procedures, we reshape the cornea in such a way that the light rays can focus on the retina. Now another thing about these procedures is that I would recommend that patients should wait till 25 years of age before undergoing these surgeries, these procedures, because till 25 years of age the size of the eyeball grows. So when the maximum limit is reached, so you can calculate the maximum or the exact refractive error, and then you can undergo the procedure. But you can also undergo if you have reached 18 years of age, but like I said, doctors worldwide suggest that you wait till 25 years of age. Now for myopic people, we flatten the cornea since the refractive power is too high, and for hyperopic people, we steepen the cornea, and for people with astigmatism, though they have an irregular shape of cornea, so we smoothen the cornea. I made my previous video on astigmatism, you can check it out. So another thing regarding this procedure is that both eyes can be treated on the same day, but it is said or suggested that we treat one on one date and another on another date. Now let's discuss PRK first, since it was the first procedure of the following that came out. Now PRK stands for photorefractive keratectomy. Now in this procedure, now let's discuss the basic common things in all of these procedures. First of all, in all of these procedures, excimer laser is used, and the change that we do in the corneal layer is in the stromal layer. In all of these procedures, we have to approach the stromal layer since it is the thickest of all, and in this one get the desired change or the desired alteration in this one, so the light rays can be focused on the retina. So the difference among all of these procedures is that how do we approach the stromal layer? That is the difference in all of these procedures. Now in PRK, we remove or shed off the epithelial lining with the help of an instrument, and then remember, you need to learn the corneal layers first, which I mentioned in my previous video. There are 5 layers of cornea, starting from the outside: epithelium, basement membrane, stroma, descendant membrane, and endothelium. So you remove the epithelium and then you approach the stroma. In this one, then we shine excimer laser into the stroma and get the desired change, which we have calculated in the beginning already. So get the desired change, and then you pat the eye, and then the epithelial lining will regenerate in a few days. Now the basic post-op side effect of this procedure is pain. These people experience pain, and for that we give painkillers. Now why do they experience pain? See, when the epithelium lining is removed, their nerve, it is rich in nerve endings, so that is why the most common complication or side effect of this is post-operative pain. So there is blurry vision in the first few days and pain, but it gets subsided, and the results of this procedure are very good. This procedure is also used worldwide in various countries. Now let's come to the second procedure, that is Lasek, Lasek. Now Lasek stands for laser assisted subepithelial keratectomy. Now this one is a derivative of PRK. Now the difference between this one is PRK is that in PRK also the epithelium was removed, but in this one the epithelium is loosened up rather than being removed. It is loosened up with the help of an ethanol, diluted ethanol or alcohol. So when it gets loosened up, it can be simply removed. And again the excimer laser is used in this one, just like PRK, to in the stromal layer. When the procedure is done, you simply reattach the epithelium layer and the procedure is done. So the difference in this one is that there's no post-operative pain. That is avoided. That's why it is much more recommended than PRK. The results of both are excellent, both are good, but Lasik, since it removes the aspect of post-operative pain, so people tend to go for this one. And this procedure in which excimer laser is used to get the change in the stromal layer of the cornea, this is known as photoablation. So that is why Lasik is preferred as compared to PRK. Now let's come to the third one, that is Lasik, Lasik, laser assisted in situ keratomelusis. Now this is the latest one of all that is commonly used worldwide with excellent results, along with SMILE. But since people are not much aware of the SMILE procedure, so they tend to undergo Lasik a lot. Now in Lasik, the main difference from the other two is that in this one a flap is created. Now this flap is that it comprises of parts of epithelium along with stroma. So some part of the stroma is also removed, and then the stroma in which you are in contact with, now you can get the desired change in it and then reattach the flap again. So this is again a painless procedure with excellent results, just like Lasik. Now there's a question arises. People say, what is the difference between Lasik and Lasik with E? They both are the same. See, the difference is that in Lasik, Lasik, you are removing also part of the stroma. So in people who have thin corneas, this procedure is not much favorable, because they already have thin cornea and you're creating a flap and also removing part of the stroma, so you're not left with remaining stroma to get the procedure going on. But in Lasik with an E, you simply remove the epithelium and you're remaining with all of the stroma. So that one is favorable for people with thin corneas. So this is the basic difference between the two. The rest of the procedure is almost the same. Both have excellent results, both are painless, and you can opt for any of them. Now another big disadvantage of Lasik with an eye is that it causes dry eyes. Now what is the reason behind this? Why is dry eye not being produced with other ones and it is produced with this one? See, when you create the flap, this causes the destruction of nerve endings. The cornea is rich in nerve endings, but when you create the flap, you're removing or destroying the nerve endings. So as a result, you are having decreased sensation to foreign particles, to dirt, and you don't blink often. As a result, this causes dry eyes. Now this complication can persist for up to 6 months to 1 year maximum. So till that time, it is advised that you use artificial tears, and this is the main complication with this procedure. The rest, it is a safe procedure and it is used worldwide. Now another thing I would like to mention in Lasik with an eye is that there's femtoLasik. Now what is femtoLasik? See, femtoLasik, now like I said, we create a flap in the beginning. Now this flap can either be made with the help of a microkeratome, an instrument, or it can be made with another laser, that is femtolaser. That is why people say in Lasik 2 lasers are used. They're referring to femtolaser in this one. If you create the flap with the help of a laser, not an instrument, but if you use microkeratome instrument to create the flap, then obviously only one laser is used, that is excimer lasers, just like the other procedures. But if you use femtolaser, then it is said that in Lasik 2 lasers are used. So this is another thing in this one, femtoLasik. People mention a lot that what is the difference between femtoLasik and simple Lasik, I would say. Now let's come to SMILE. We will discuss this again in some other video. I will make another video on it, but I will give you a brief idea about it. It stands for small incision lenticule extraction. Now in this one, we don't remove the epithelium or create a flap. We simply make an incision on the side and approach the corneal stroma directly, and you get the desired change in the stroma. There's a small incision that is present that can be healed, and you can go on the same day with with excellent results. Just like the other procedure, it is safe with brilliant outcome. So I will make another video on this, and like I said, people are not aware of this procedure so much, so that's why they prefer Lasik, and it is very commonly used worldwide with very little complication. The main complication, which I said, is dry eyes. So guys, after watching this video, I hope you got a brief idea, and do comment which one of these procedures you think is the safest and you would like to recommend to your relatives and why. Please do comment. Until my next video guys, take care.